In this video, I want to talk about 3 really important things to avoid when you're preparing for your PLAB 2 exam. I'm Dr. Arora from Arora Medical Education. I've been helping thousands of doctors pass their PLAB 2 exam for many, many years. I used to be an ex-GMC PLAB 2 examiner, so I see lots and lots of preparation styles, and I see lots of doctors preparing for the exam, and I see some good things and I see some things that don't often help. So these are 3 things that I really want you to try and avoid in your preparation if you're currently preparing for the exam. These are things that we talk a lot about in our mocks and our live courses and online courses and all the other things that we do for PLAB 2, but this is just a brief overview so you can keep them in your mind when you're doing your role play practice and when you're preparing. Throughout this video, please do comment if you have any other suggestions of things that people should be avoiding. But let's talk about the 3 that I think you should be focusing on in avoiding when you're preparing for your PLAB 2 exam. Number 1, I want you to really try and avoid losing your own style. I see so often really good doctors who have developed a style of consulting over many years, may have seen thousands of patients, whether at medical school or when working as a clinician, but when they come to PLAB 2 preparation, they lose their own style and they end up looking like a robotic doctor. This is so sad because you guys have, like I said, honed your own skills. You've developed strategies for dealing with different types of patient, different types of situation. You've softened those skills over time. You've figured out through practice what works, what doesn't work. You have so much that you can offer to a consultation in terms of interpersonal skills, but also the way you approach your data gathering and management. But when it comes to PLAB 2, people just lose their own style from fear of trying to be the doctor they should be for PLAB 2. And this robotic style that ends up being demonstrated does not do you any justice. It looks like the lines that you're saying are not natural to you. It appears that you've learned things and you're saying them for the 6th or 7th time in your life rather than the 6th or 7,000th time in your life. And it's really sad when doctors don't trust their own style, and that has a huge impact on the consultation. It has a huge impact on rapport, and it really does have a huge impact on somebody who's watching or listening to a particular consultation. So the first thing that you really need to avoid, and this is a really important point, is whatever you learn, whatever you read, whatever you're taught, don't lose your own background underlying style, because that style, that confidence in that style is going to help you pass and get through the difficult situations in role plays where you're a little bit unsure. If you're already unsure about a situation because you're trying to think about what should I do, or what have I been told to do, or how should I be appearing, then you're going to find it hard to deal with the challenging situations that you inevitably will come across when it comes to the PLAB 2 exam. So the first thing I really want you to focus on this when you're practicing is do not lose your own style. If people tell you you're doing too much of this or doing too little of this, or you're not having enough hand movements, or you're making too much or too little eye contact, or the way that you're sitting is not right, just let it go through one ear and out the other ear, because you need to stick to your own style so that you feel comfortable to demonstrate the skills that you have in order to pass PLAB 2. So number 1, avoid losing your own style, and therefore avoid looking like a robotic pre-rehearsed doctor. The second really important thing to avoid is practicing through a case-based practice approach. What do I mean by this? Whenever people are preparing for PLAB 2, and I see this all the time when we do our courses and our teaching and our mocks, is that people often have prepared and practiced role plays in a case-based way. So for example, they'll have spent time doing a diabetes case and a hypertension case and a COPD case and a young person case and an arthritis case, for example, or a counseling station, for example. People tend to focus on case-based practice and think that as long as I know how to handle a diabetes case and I've practiced it, when a diabetes case comes in the exam, I should know what to do. Now, this does not work. For any of you who've been in our courses or seen our teaching, you know we talk a lot about not case-based practice, but situation-based practice. And that's how you should be focusing your role play practice when you're sitting with your friends doing your role plays. What do I mean by situation-based? There are only probably, I don't know, 20 or 30 maximum situations that you're going to be exposed to. What do I mean by a situation? A chronic disease scenario, an urgent case, an emergency case, a telephone case, a third-party situation, a teaching situation, a situation of an angry patient, a blasé patient, a demanding patient, an embarrassed patient. There's only so many situations that you can have. And if you get used to practicing these and using some of the skills and techniques that we teach for those, and you become comfortable in dealing with these types of situations, these 20 or 30 situations, the medicine, the cases will just end up slotting in. For example, yes, you can practice a diabetes case or hypertension case, but the case is completely different if that person is blasé or angry or demanding. You may know the diabetes bit or the hypertension bit, but how do you deal with that situation? I often see people don't have the practice, the preparation, the confidence, the ability to deal with different situations. Their knowledge is good because their case-based practice has been spot on, and you've got lots of good feedback in your role plays and your mock exam saying that you're really good, you're going to get really high scores, but then you get to the situation that throws you, and that's where the lack of practice can really show at times. So when you're preparing for PLAB 2, when you're practicing with friends and role plays, and even when you're doing mocks, for example, try and focus on situations and make sure you're comfortable with the 25 or 30 or so different situations. We teach all of these on the online course that we have and the audiobook courses. Just make sure you focus on those, because yes, everybody else is going to be trying to do as many different cases as possible, and there could be hundreds and hundreds and hundreds of these, but that doesn't mean that you're going to be able to do that when the situation alters in the exam itself. Because remember, in the exam is not just testing your ability to deal with knowledge and what questions to ask and what things to say in management. It's also about how do you manage the situation in front of you, and that includes the way that you relate to different types of scenario, and that's really important when you're practicing for PLAB 2. So make sure you focus on these and don't avoid, or do avoid, I should say, a case-based practice approach. Now, before we move on to the third really important thing that you should be avoiding in preparation, don't forget the coupon Arora Video 10 for 10% off any PLAB 2 resource that we do, whether it's our gold package, our all-in-one comprehensive gold package, whether it's our mock exams, whether it's our live course, online course, audiobooks, flashcards. Make sure you use that coupon Arora Video 10. And if you like this video, please do subscribe to the channel. We have so much more for PLAB 2 on the YouTube channel, so please do check those videos out if this is the first time you're coming across us. But the third thing that you really should avoid, and we've talked about this in a previous video as well, is avoid script-based practice and script-based learning. It doesn't work. You could learn 1,000 different scripts and you turn up to an exam like PLAB 2 and 3 words change the whole script completely. And if your whole practice has been based on scripts and learning scripts as if they are gold, then you're going to get to that exam and that 1 or 2 word change will throw you, it'll stress you, it'll cause you panic. You'll think, oh, I didn't read this script, I've never come across this script, I don't know what to do. Your brain will start to give you a lot of panic and stress. Don't practice script-based learning. If you want to read about situations and scenarios and go through them for your own understanding, to expose you to different types of situations that you may come across, to get you thinking about the kinds of questions that you might ask in a particular situation, that's fine. You can use things like that to just read through and get yourself comfortable with different types of scenarios so you understand what kind of things can come. But do not learn scripts word for word, please, 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 because you're going to find yourself under a lot of stress in the exam when 1 or 2 words are different. Maybe in the past, script-based practice was the way to go in terms of PLAB 2. PLAB 2 has obviously changed significantly in the last 5 to 10 years, but please don't go with that approach right now. And if you go to somebody and they start teaching you scripts and giving you, 1,000, 2,000 page booklets to learn and read, be a bit smart about how you use that material. Yes, read through stuff, understand things, but don't try and learn it word for word, because it just won't play out like that in the exam, and it will lead to a lot of disappointment and ultimately lead to a lot of low marks in your exam as well. So please avoid a script-based learning approach. If you look at all of our courses, like the online courses, for example, we don't go through scripts because it's all about scenarios and situations, because that leaves you more confident than thinking that I've now learned 2,000 pages of text and I'm ready for this exam. So the third thing to avoid, and I really, really hope that you'll take this advice aboard, is to avoid a script-based learning approach as if scripts are the gold standard and the gold-plated way to get through PLAB 2. So to summarize, 3 really important things that I really ask you to try and avoid in your preparation. Number 1, avoid losing your own style. You're good enough to stick to your own style. Number 2, avoid a case-based practice approach. Think about situation-based practice. And number 3, avoid learning scripts as if they are pure gold. I really hope this video has been of some value. Like I said, please do use the coupon Arora Video 10 and try and get yourself on one of our PLAB 2 courses, the online course, the all-in-one package, mock exams, audiobooks, flashcards, live course, whatever suits you best. I really hope this video, like I said, has been of some value. Please do check out the other PLAB 2 videos on the channel. Please do subscribe to the channel. Please do drop a comment down below if you found this of some value. You know the hashtag CanPassWillPass. #I went with Arora. Have a super day.